The rotator cuff is a group of 4 muscles that surround the shoulder. Muscles turn into tendons as they attach to bone. Sometimes we use the word muscle and tendon interchangeably in this scenario, but it is important to be precise when it comes to defining the diagnosis and therefore the treatment approach. A pet peeve I want to remark on today, though, is that people often talk about rotator cuff disorders or problems, and to me that's just way too vague. Yes, these 4 muscles share some commonalities. They provide stability and they also provide rotational mobility at the shoulder joint, but they're different. And because they're different, we should see in clinical testing that it's borne out. Is the problem in the supraspinatus that primarily elevates or abducts the shoulder joint? How about the infraspinatus or teres minor that are primarily responsible for external rotation, or the subscapularis that's more responsible for internal rotation? Just by knowing that alone, you would expect that we would have different test findings when we test the shoulder in the clinic. As a reminder, when I take the specific verbal history, take my orthopedic baselines of range of motion, strength, nerve tension, and function, and then do repeated movement testing and possible other orthopedic special tests, I usually find that by getting the joints moving better, either in the neck, mid-back, or shoulder, gets the shoulder complaints resolved, abolishing signs and symptoms. Then there are also some subscapularis or supraspinatus, infraspinatus, teres minor problems, yes, typically in the supraspinatus when it comes to elevation, but I would focus there on a specific treatment looking at remodeling a tendinopathy with progressive loading, or if there were a tear, restoring strength to the remaining part of the tendon or muscle that's not torn. So my point is, don't be vague, because then you have a vague understanding of the problem and a vague set of treatments. If you can be specific, where is the lesion? What is the lesion? If it's in a contractile tissue, meaning a muscle or tendon, if we've ruled out the joints with good repeated movement testing and we find that the problem is in the contractile tissue, then in those cases, the treatment is also quite specific. Loading that contractile tissue, possibly some other supportive exercises. But I argue that you're going to get better outcomes when you're specific with the diagnosis and can apply a specific treatment versus when people refer to a vague problem like a rotator cuff disorder.